Yes, well, 43% of people say their mental health has got worse since the start of the pandemic. Research showed that nearly 1 in 3 UK employees took leave last year to address their mental health, with employees in the south taking off more days amid higher job uncertainty.
Yes, well, this time off is estimated to have cost businesses £12.7 billion, with workers taking 3 or 4 days off on average. But wellbeing experts say this cost is worth it, as in the grand scheme, these days off improve morale and reduced burnout. Here to tell us more on this is wellbeing expert Anji McGrandles. Good morning. Thank you for joining us. There's, I suppose, good news and bad news in this. The bad news is that it does seem that the mental health of the nation has got worse over the pandemic. But I do notice that in this research, it says the discussion around mental health and well-being is improving.
Good morning. Yes, I mean, it's hardly surprising that there's been a deterioration in people's mental health. The pandemic has brought about a lot of change and uncertainty. Our routine and our life as we knew it was turned upside down 2 years ago. And as we know, positive routine is good for our mental health. And having to constantly adapt to change and the uncertainty will have taken its toll on people's mental health and made us more prone to negative thinking, anxiousness and stress. But like you said, I definitely think the pandemic has highlighted the need for us to address mental health.
To addressing mental health, do you have any faith in our National Health Service at the moment? Because I know people who have accessed mental health treatment privately through private healthcare insurance and things, and their experience compared to people who've accessed it through the NHS, there's no comparison whatsoever.
No, and I think there's a bit of a postcode lottery, unfortunately, when it comes to what we can access across the NHS. There definitely needs to be more investment across the NHS in mental health. And like you said, I think, people who have tried to access NHS treatments have sometimes not received the care as quickly and as they should have.
Another thing in this research, it says that there's a north-south divide, actually. I think people in the north, in the south, are more concerned about losing their job. They say they're reporting poorer mental health. I just wondered why you think that might be, because we are often told, people, the north is the more deprived part of the country, and you'd expect perhaps people to have more mental health problems there. I mean, is this the case, or are we just seeing a reversal of the trends?
I think what we're probably seeing is people who are in employment will still have financial worries around job security. We had obviously the furlough period right at the beginning of the pandemic. So a lot of people will have been worried about whether or not their jobs are at risk. And there's been a massive increase in burnout as well, employee burnout. So there was a study last year that showed that 40% of UK workers were on the brink of burnout, and they said that was due to work stress. So I think people who are in employment are still at risk of poor mental health because they are working longer hours, boundaries are blurred when you're working from home or you're hybrid working. And like I said, this leads to a risk of burnout and adds more stress to workers as well.
Yeah, obviously, this is focusing on employees and it's focusing on adults, but I'm quite keen to get your take on what's going on regarding our children as well. They've had a very, very, very tough time of it, haven't they? They've been, you're in school one day, they're out the next, they've got to put masks on, they can't hug people, etc., etc., etc. Has their mental health really suffered, do you think?
Yes, again, there's been lots of studies out in the past year saying that the mental health of young people has deteriorated. And again, that's not surprising because, like you just said, the whole change and uncertainty, children love routine. And when their routine is disrupted, it's going to make them feel anxious. I know a lot of schools have started to implement mental health programs, but I do think there needs to be a big investment in schools. And I think if we make a big investment in children, then our future generation will be better equipped to deal with stress, pressure and poor mental health.
Anji McGrandles, thank you so much for coming on our show and discussing this really important research, which I'm sure many people will relate to. Anji McGrandles there, Wellbeing expert.
I love that name as well.
Yeah.
Anji McGrandles.
Very unique.